Last week, experts from leading health organizations released new guidelines calling for no caffeine for children under the age of 18. But a new study shows more children are being exposed to it, sometimes by accident. Mandy Gaither breaks down the research and explains why these exposures are on the rise.
The full impact of caffeine on children is still unknown, but it is clear the substance isn't healthy for their developing bodies.
The most common clinical effects that we saw in our study were agitation, nausea, vomiting, and fast heart rate.
Dr. Hannah Hayes is co-author of a new study published in the Journal of Medical Toxicology. She, along with researchers from Nationwide Children's Hospital, found a 17% overall increase in caffeine energy product exposures in children and teens, which were reported to U.S. poison control centers between 2011 and 2023. The exposure rate to caffeinated liquids, such as energy drinks, rose 35% in that time period, and that rate for caffeine powders, like ones taken before exercise, skyrocketed 633%.
I was surprised that almost 70% of the exposures in our study were in children under 6 years of age.
Hayes says those surprising results may be due to the increased availability of these products and colorful packaging, which can be attractive to young children. They're also naturally curious and enjoy exploring their environment, or may see adults drinking these beverages and want to try them. She says the best way to keep children safe from unintended caffeine exposures is to not have them in the house.
However, if you do choose to keep these products in your home, you should store them in a safe place away from children.
For Health Minute, I'm Mandy Gaither.
Researchers say most caffeine-related cases in kids and teens weren't linked to major medical problems, but some had dangerous effects. Researchers found 22 cases of seizures, and some children even required care from a hospital.